So at ELCC, we also had updated 3-year survival data from KEYNOTE-407. So you'll remember that this was a seminal study in which patients with squamous tumors were randomized to receive platinum and either paclitaxel or Nab-paclitaxel, or the same with Pembrolizumab. The chemo was given for 4 cycles, and there was clearly a survival advantage in the whole population, driven predominantly by the 50% plus, but also a benefit in the other groups. This 3-year survival data really was very exciting because it showed a near doubling of the overall survival to 30% and a near tripling of the progression-free survival to 16% compared to just chemo alone. So really, if we're thinking about it, this is telling us that our patients are doing phenomenally well at a really very long period of time after we would naturally expect them to have benefit. So we're having nearly tripling of overall survival. So, that does mean we're going to have more patients in our clinic, which is a great thing, but it also means that our health infrastructure needs to be able to cope with the additional rigors that this requires. The other really interesting piece of good news was what happens to those patients that complete 2 years worth or 35 cycles equivalent of immunotherapy, because the concern has been that maybe as soon as you stop the drug, the patients then immediately relapse. Now, we didn't think that was the case, and indeed this trial has demonstrated that just over 90% of patients were still progression-free 1 year after discontinuing their immunotherapy at the 35-cycle time point or 2-year time point. So the benefit is durable, and it really speaks to additional questions about how long do you need to continue immunotherapy for, who needs to continue further, and who can safely stop. And this is an area that we really do need to have more data on. Who these patients were? Well, the vast majority of patients were those that had a response, either complete response or a partial response. So if you do well on immunotherapy, it means that you're in very good likelihood to get to the 35-cycle time point. And if you get to that time point and discontinue, don't despair, because the data so far shows that there's every likelihood that you're going to be progression-free for an additional year thereafterwards. And this is very welcome data.